Joined now by Mohammed Munir, Professor in Virology at Lancaster University. Thanks so much for being with us on the programme, Professor. Firstly, tell us a little bit more about this particular strain of Ebola. What are the symptoms? How contagious is it?
Well, if we look onto Ebola viruses, there are at least 5 different types of Ebola viruses. One of them is called Bundibugyo virus. This is relatively uncommon, rare, only 2 times have caused outbreak before. But almost all of the Ebola viruses, they start with fever, muscle ache, vomiting, diarrhea, which are a very common symptom for many of the diseases. But in particular case of the Ebola virus, when the disease progress, the end result is that the majority of the openings of the body, like ear, nose, mouth, start bleeding. And that is a very pathognomonic, which is a very characteristic feature of the Ebola viruses. And that is the time when the majority of the people who are either in the deceased person's funeral or in the healthcare setting of this diseased person or the second person treating them catch the infection. So mainly the virus spread through the bodily fluids such as semen, saliva, or the blood or the vomit when it comes out of the deceased or the sick person.
And do we know if this strain of the disease is more dangerous, and how do you treat it if there's no vaccine and there isn't really any drug treatment specifically for it either?
That's a very important question. So basically, if we look on to the previous outbreaks of this particular strain of the Ebola virus called Bundibugyo, there have been only 2 outbreaks. And based on that one, it is less pathogenic compared to the 2 most common Ebola strains, which are Zaire and Sudan Ebola viruses. Around 27% people who have been infected with Bundibugyo, they have died. But Bundibugyo strain of the Ebola virus only shares 60% of the genetics commonalities with the Zaire and the Sudan Ebola viruses, which were very common. So majority of the vaccine, the treatment, and the test to detect the infection for common type of Ebola viruses are unfortunately not sufficient to detect, to treat, to vaccinate against Bundibugyo viruses.
And why do you think there was this initial delay in detecting the presence of Ebola here? It's believed that the virus might have been circulating for weeks before it was first detected back in April.
Absolutely. I think there are 2 main reasons. Number one reason is that the initial symptoms of the Ebola viruses are the same for any infection. So those can go unnoticed quite clearly. And majority of the people in that part of the world, they first go into the witchcrafts or some of the prayer areas and get the treatment from there until they really notify to their health authorities when the situation is already very aggravated. And number 2 is that the tests that initially were deployed for this strain of the Ebola virus were not really meant for this strain of Ebola virus. So therefore, those were tested negative, which were actually positive. So it only came to know when they started sequencing the strain, and then they identified that it is a Bundibugyo virus. So therefore, overall, the delay had led to spreading of the infections under the carpet. And now I think there are a lot more cases that have already been identified.
Yeah, I was going to ask you as well, if it took so long, relatively speaking, to detect the virus, can we be sure really how big the current outbreak might actually be, and how many contact cases there could be potentially as well?
Absolutely. This is also a very important question, and we don't really know yet what is the scale of the outbreak. But what we do know is that the scale of the outbreak is way bigger than and larger than what we are having now. And that is the reason World Health Organization decided as a public health emergency of international concern. And you can imagine also by the fact that people who were traveling from DRC into Uganda, Kampala, for example, is around 1,200 kilometers away from Ituri, where the hub of this outbreak has been. And those people, one of them has unfortunately died. And the spread is gone beyond Uganda. In, for example, Rwanda is another target for this outbreak. So more of the uncontrolled and porous border are open, more chances for this virus to spread, unfortunately.
And another risk factor, obviously, the violence in the region. How hard do you think it's going to be to get help to where it's most needed? Armed conflict, also general distrust are said to be hampering containment efforts generally.
Absolutely. And I think this is probably the most important aspect for controlling Ebola virus. And as we all know, that Ebola virus outbreak in DRC and a broader context of the Africa is not a new thing. I mean, we have had at least 40 different outbreaks of the Ebola viruses since its first identification back in 1976. And out of those, 17 has been in DRC. And there are several reasons for that. One of the major reasons is that the bat population, which is the reservoir, which is the carrier of the Ebola viruses, they are very common in the DRC and part of the Central Africa throughout the length of that as well. And then other aspect is that the borders are porous. Overall health infrastructure is quite poor. And other than that is the political instability. All of these factors are precipitating and unfortunately would have a negative impact onto the outbreak moving forward.
And Professor, as well, we're hearing that a funeral procession has been linked to the outbreak. Local authorities there are saying as well that people seemingly believed the disease was a mystical illness and that there'd been rumours that the area that it was initially spreading in was cursed. So what kind of a role do you think public health campaigns need to play here in providing information about how diseases as dangerous and potentially deadly as Ebola can spread?
Absolutely. And not only in this particular outbreak, in the previous outbreaks as well, the majority of the cases are either in and around funeral, family contacts, and in the ceremonies where body is either being prepared for the funeral, and in the hospital setting where doctors are and the healthcare professionals are very close to the infected person. And this is the critical bit, because for this particular strain of the Ebola virus, we don't have much options. We don't have treatments, we don't have vaccines, and some of the tests are also not the perfect tests. So we only left with very few options, and those are we call non-pharmaceutical options, by which I mean is that the contact tracing, the isolation, proper awareness within the community, who to report to at the first instance, and making sure that people who are showing clinical sign, even if those are early clinical signs, they are properly documented and reported so that the spread within the community can be minimized.
And do you think this outbreak will be quickly contained? Difficult to say, of course, when so many questions remain. But is it likely, Professor, do you think that there is a chance that it might spiral into a repeat of what we saw here just over a decade ago?
But it is less likely that it would become a COVID-like pandemic. For one particular reason is that the more deadlier the disease is, harder it is to spread. For example, a person who would be terminally infected with the with the Ebola virus is going to be complete contrast to the COVID person starts showing so characteristic clinical sign like blood oozing out of all the opening of the person. Unfortunately, that person is not going to make it longer, but that also means the spread would be relatively harder compared to COVID or measles infection. So I'm not seeing this one as it become a global pandemic. But what I can see is that within the DRC, the neighboring countries and East Africa is going to certainly be a problem.
OK, we'll have to leave it there for now. Professor, thanks so much for being with us, though, on the programme this evening. That is Mohammed Munir, Professor in Virology at the UK-based Lancaster University. Well, that's it from us.